Okay then. So, well, first of all, thank you ever so much for taking time to talk with us today.
Time is, I can assure you, is not a problem.
We're very grateful. So perhaps first of all, could you just introduce yourself, George, and tell us a little bit about you?
Right. Okay. Well, I'm Dr. George Deutsch. I qualified at the Middlesex Hospital, which no longer exists, in London in 1967. And after a few years of postgraduate training in general medicine, I decided that I would go in for the specialty that was then called radiotherapy. That's all it was called, because there was no chemotherapy, or virtually none.
Wow.
And I trained at the Middlesex and Mount Vernon, and it was an exciting time because chemotherapy was just beginning. It had been around for leukemia, but not for other things. So we were just beginning to learn with it. And after 4 years of postgraduate training in radiotherapy, I looked for a consultant post, and there was a vacancy in Brighton. And that's where I was appointed as a consultant in 1974, a long time ago. I was rather young. I was unusually young. And there were only two consultants, me, and the senior consultant was a man called Jan de Winter, who you might have heard of. He was quite well known, quite a character. And that's where it all began, really. We started out, it was called the radiotherapy department. And it's the building that's still there, although it's the Sussex Cancer Fund really has changed it a great deal. We'll come back to that later. But it was called the radiotherapy department. And then gradually, chemotherapy became more important. And I can't remember when, but we changed the name to the Radiotherapy and Oncology Department.
Right.
And then later on, and again, I can't tell you when, it changed to the Radiotherapy and Oncology Centre, but the word cancer was avoided. And I'll come back to that in a bit, which is one of the interesting things that's happened. But then later on, and I would say we're talking about, I can't remember, but probably in the 1990s, it got it became changed to the Sussex Cancer Centre, and it was acceptable to use the word cancer. But it was a long time before it was. And of course, the charity changed its name in parallel with that.
Which brings me to, why did you set up the Sussex Cancer Fund?
Okay. Well, it goes back a very long way. Actually, before 1981, I'd really just my Dr. de Winter retired, and I became the head of the radiotherapy department, as it was. And it was really a pretty tatty place. It was grubby. There was no wheelchair toilet, for example. The waiting room was awful. All the chairs were falling to bits and very hard. It was generally looking pretty poor. And it was quite obvious that we were not going to get any money from the NHS. And so I set up a fund. It wasn't actually an official charity. The hospital had various funds and you could use them as the sort of administrator under a sort of umbrella. So I started out with that, and we got I got the evening. I can't remember how, so long ago now, but I got the Evening Argus interested, and they wrote an article. And in fact, that was the first article in my scrapbook, as it happened. There it is.
Oh, wow.
Doctor and the Missing Therapy. But it was all about, we needed chairs and money to build a wheelchair loo and things like that. And it started from there. Money started coming in. I had a friend who was a solicitor. No, I lie. He was an old patient. who was a solicitor, and together we set up a proper charity, and that's how it happened. And it's gone well, as you know. It's gone from strength to strength. From very small beginnings, we've now collected, I don't know how many millions, but certainly many. So that's how it happened.
Were there any memorable fundraising events that really stuck in your mind?
I mean, there were so many fundraising events. My wife and I were treated to quite a lot of enjoyable dinners and balls and all those sort of things where we went along, and we often did it together, you know, how to make a speech and receive a check from generous people. So, but I mean, they were enjoyable, but I mean, nothing, not sort of exceptionally so. I think the most remarkable fundraising thing I think I came across was actually not long before I retired from as a doctor, not from the charity. I had a patient, an old man with bone cancer, and he was a marathon runner, and he had continued to run at least half marathons well into his 70s, and he continued to run these half marathons for the Sussex Cancer Fund, despite the fact he was in pain. It's absolutely amazing. And he used to come and see me for his checkups, and he'd say, "Oh, I've just done this, and I've collected another, whatever it was, a few thousand for you," or whatever. And on one occasion, I was invited to go to his athletics club to collect a check. And I can't remember whether it was Peacehaven or Seaford. It was in that direction. And the people there were lovely, but they were all absolutely in awe of this elderly chap who was managing to run half marathons with bone cancer. I was always terrified he'd break something while he was running, but he never did. So I think that's the most sort of staggering thing anybody did. I'm sure there are lots of other things. I'm afraid I just don't remember them.
But that's so inspiring, isn't it?
That is. I mean, it was just extraordinary. But people were very courageous. And there's no doubt about that.
So, in your time as a doctor, what were the most significant changes? You've talked a little bit about how you couldn't mention the word cancer, which
that's actually,
I had no idea about. You know, what else would stand out?
It's that it's worth developing a little bit, because it leads into all sorts of other things. I mean, the biggest change, obviously the most important change, is that the treatment of cancer has got so much better in my professional lifetime. When I started out, people were being cured, but not that many. We were able to help a lot. But the word cancer was associated in most people's minds, including doctors, with a death sentence. Wasn't always true. Since then, of course, there's been vast improvements, and although there are still huge problems, particularly with some types of cancer where diagnosis is always late, but with others, the cure rates are now utterly different from what they were when I started out, well, nearly 50 years ago. So very different. And maybe it's because of that, I don't know, but I'll tell you a little story because of attitudes that, again, I was reminded of just thinking about it. In the first week of when I came to Brighton in 1974 as a consultant, the senior surgeon asked me to go and see a patient on his ward. He said he's got advanced cancer. Just can you go and see him to see if there's anything you can do to help him? So I went to see him and I had a look at him on the ward and realized there wasn't anything I could do. Nowadays, he'd be offered chemotherapy, but there really wasn't anything there. And I sort of sat down and talked to him a little bit about, I'm sorry, I can't do anything. And then he said to me, "Doctor," he said, "nobody will tell me what's wrong with me." So I quite know how to handle this, but I think I said, "Well, tell me what you think is wrong." And he said, "Well, I think I've got cancer." So I said, "Well, I'm sorry, you're right. You have got cancer. You're right, and I'm sorry. There isn't anything more we can do for you." And of course, he said, "Am I going to die?" And I had to sort of explain, well, yes, but we didn't know how long, but it wouldn't be very long. And he said, "Well, I'm incredibly grateful to you, doctor, for telling me. I desperately needed to know." Anyway, that evening at home, I got a telephone call from the senior surgeon. He said, "How dare you tell my patient he's got cancer? We don't do that sort of thing." And I said, "Well, times are changing, and we do have to talk to patients." And he came round to my view. But that was the attitude, 1974.
Wow.
And so, of course, since then, gradually, and it happened a great deal in my time. Again, when I started, patients weren't offered a choice. They'd come to see you and you'd say, "You need radiotherapy." There was no sort of, "Yes, perhaps you should have radiotherapy, perhaps you should have this." There was no question of, options and choices, and you didn't talk. And as a result, we only two consultants. We were able to deal with a very large number of patients because you didn't sit down and talk to them. It was just, "Come in, that's what you need done, go away and have it." And gradually, of course, that changed with talking to people.
Thank you, Dr. George Deutsch, for telling us a little bit about how the Sussex Cancer Fund was started 40 years ago, and indeed about how cancer treatment has changed and attitudes to cancer have changed over the years. After we finished recording, Dr. Deutsch expressed his gratitude and thanks to all the supporters over the years that have helped the Sussex Cancer Fund become the force it has in Sussex, helping cancer patients and improving treatment. We do hope that we will continue to get support so we can go from strength to strength and help even more cancer patients in Sussex for generations to come.